Medicine is more than just your interactions with your patient. There has to be someone protecting your interactions with your patients. The only entity I know who is truly advocating for that moment for you as a doc, with you and your patient, the only people is SCMA.
The advantage to something like the South Carolina Medical Association is it reminds us as physicians that we do have a responsibility to advocate for the good of our patients.
Most physicians don't realize all of the things that happen at the State House in Columbia.
Before I was part of the SCMA, I had never called a state legislator, emailed a state legislator, even met one or talked to one. But in the last few years, I've done all of those things.
We have to have a mechanism to come back and be that collective voice, and the SCMA is such a powerful way to do that.
A collective voice and advocacy is important because it's numbers. But what helps in the collective is when our lobbyists go down to the State House representing this many thousands of physicians.
As an employed physician who is very happy being an employed physician, there has to be someone else speaking on my behalf. And that's really what SCMA does from an advocacy standpoint. They're on the front lines representing all physicians in the state of South Carolina, regardless of your employment status.
I think it's very important for physicians to stand together as a unified voice, and we can make sure we are providing the right care for our patients and also look out for each other.
At the annual meeting, I met people from all specialties all around the state.
You get a different perspective on some of the plights of our patients. So you get to be introduced to some scenarios that you've never heard of before.
With the support of multiple physicians, it's much easier to make powerful changes as opposed to going individually to a healthcare system or private equity group or even individually to the State House to talk to representatives.
We sometimes try to take on the world alone. And if you have others who are like-minded, going through the same things that you are, that support adds a different level to your professional experience and sometimes makes things a whole lot easier.
The real reason you go into medicine is to take care of patients. And with so many powerful external forces influencing how the machine works in healthcare in America, it is critical that physicians do what we can to salvage and protect what the profession of medicine represents.